Yeah, I saw a lot of really great comments in the chat box. Let's see, anything else? Some of you kind of covered this, but it was some of them looked like they were feeling a little awkward. Did they seem like they were more comfortable when they were buddied up with somebody or when they were functioning independently? Yeah, mostly they liked having a buddy. There was the one girl who who thought she was hot stuff, who just really was fine on her own, but pretty much everyone else was feeling a little awkward or wanting to have that buddy. Another thing that I didn't see in the chat box, but is actually kind of hallmark for the age, and that is having a social conscience. So the whole point of that video, what was the point behind the video? Did anybody catch that at the very start? Right, to stop bullying. So they have a social conscience, and they wanted to kind of get a message out, and that's what they were all organized about. And I don't know who spearheaded it, if it was the kids themselves or if it was a principal or teachers, but the kids were definitely in the game. Okay, now I'm going to just a second here. We're gonna hopefully you all did. I can't get my mouse where it needs to go. Okay. Okay, hopefully you all wrote your letter to yourself during that break, and I'm going to start a poll and go ahead and respond to it, A through D, which you did more of in your letter to yourself. And probably a lot of you used a combination of a variety of these, but I want you to choose the one that you did the most of. Okay, well, we got almost everybody respond. I think actually everybody did respond, so that was good. Gosh, it didn't publish it. I clicked to. Okay, sorry. Go ahead and put in your response again. When I clicked to publish it, it did a funky thing and it didn't put it. Okay, I think that's everybody. Okay, it's telling me the poll results were published, but I'm not seeing them. Maybe you guys are. Anyway, 54% of you, so over half of you, gave yourself advice. A third of you gave yourself encouragement. And then each of you gave an update on your life and provided a listening ear or offered understanding. Okay. Let's see here. Oh, I see where it published it was right. Okay, that makes sense. It published it on the slide instead of on the screen share. Okay. right. Let's go ahead and get going with this adolescence. So here are our objectives. So this is my daughter. She was on the ballroom dance team in high school, and so she's in a gown there. And these are our presentations that we have for this unit. There's only two. One of them will be today, and the next one, so hospitalization is today, and firearms is tomorrow, I believe. Our objective one is developmental theories, as we've been doing. This is the last unit where we're going to follow these same objective patterns. So if you're starting to get tired of these objectives, this is the last set. Okay, so for Erickson, he has established that his theory is that as adolescents, they go through the phase of identity versus role confusion. Oh, wait a second. Yes, you are on the schedule. For some reason, the slide was missing. That was my cue to have you guys, wait a second. Yes, I'm so sorry. Yeah, you should have gone this morning, but the slide I had for you guys was missing from my PowerPoint, so I didn't get the little signal to remind me to have you guys do it. So we will have you guys go just before, when we break for the hospitalization presentation, you guys will go first, and then our hospitalization team. So we'll, as soon as we finish objective one, thank you for reminding me that you guys are on the schedule for that. Right. I was a little flustered this morning because when I got here, I realized I didn't have my flash drive, so I had to hurry and pull things together, and so that might be how it got dropped. Okay. Could you guys tell I was flustered? Or did I hide it? Anyway, I'm not going to take a poll on that one. Okay. Thanks, Brooke. Let's see. So I told myself, I'm not going to tell them that I was an idiot and left my flash drive at my home computer. But I'm just like, I would never be able to do poker because I'm just like, no secrets. Anyway, so back to Erickson and his theory for adolescence, which is identity versus role confusion. So in this age, they are really developing a strong sense of who they are, independent from their family. And at the same time that they're kind of pushing away from their family, they're also wanting to kind of fit in more with their peers. So but that is part of their identity, is who they associate with, who they want to have be there, the people they hang out with and spend time with. So they're going to start questioning their beliefs. They may have been raised with a specific belief system, and they're going to look at it and they're going to decide if they really own that belief system, if it's something that works for them, or if it's something that they want to just dispense with and develop their own belief system. And that kind of lends itself to role confusion, because let's say if they were raised to believe one way and they're thinking, maybe I'm not really that way. So it can be a bit of a confusing time for them. And it's really important that they can have some guidance and some listening and understanding ear as they do their soul searching. Mood swings are very typical of this age because of all of the things they're going to, which we'll talk about in detail as we progress through these slides. But it's important for caregivers to grant adolescents independence so that they, as they're pushing away, they can establish their own boundaries. However, the parents do need to provide the safeguards, and so give them room to grow, but don't smother them, but don't leave them stranded either. It's kind of a delicate thing, finding that perfect balance. It's also good to note that Erickson suggested that adolescents work through all of the previous stages as well. So it's not strictly the identity versus role confusion. They've got to reestablish the trust that they feel of trusting their parents, trusting their peers, trusting their teachers, autonomy. They're seeking their own individuality. That's huge for this age group. And then initiative, just developing their own vision, what's important to them. And industry, they're very engaged, very busy, have lots of energy. And that's one of the first things I noted in that video that we just watched, that this age group has energies. They're doing the backflips and the jumping around and things like that. Okay, for Kohlberg's moral development, there are actually 2 stages in this age group. So the first stage, it's actually stage 4, which, if you remember over here, we've got the stages listed. There's the pre-moral, or 1 and 2, and then that's too small for me to read, but conventional, I think, is what it is. Yeah, stages 3 and 4, and so this is the age, the early pre-adolescents, actually, the tweeners, the 10, 11, 12. They are in this law and order. Everything needs to be fair and just, and have a strong concept for obeying rules and respect for authority. This is the age. This is the stage that 80% of people stay at throughout their lifetime, according to Kohlberg and his followers. It's not like it's a cult. I just can't think of a better word to use. People who espouse his theories. So, yeah, that's about where most people cap off, is at stage 4. It's possible, though, for adolescents to progress beyond stage 4 into stage 5, which is a principled level. So this moves up. It's its own category to be more principled. And it's the one where you have, excuse me, you can base moral judgment more on what you feel is right or wrong versus what the law is. So remember the story we heard in the school age development about, they told the story about the husband whose wife was dying, and there was a medicine that would save her life, if but he couldn't afford the medicine, so he was thinking about, or maybe in the story he actually did break in and steal the medicine to give to his wife to save her life. So all of those kids said, no, it was wrong because that's breaking the rules. If you ask that same story of an adolescent, a lot of them are going to say he did the right thing because what's more important is saving his wife's life. So let's see. And then culturally accepted values define the personal standards. So and that story I just shared kind of illustrates what you value more, keeping the rules or the life of someone you love. Okay. And then it's this age, it's really, to get to that higher, more principled level, it really helps to have a mentor or a parent or somebody that adolescent can talk to, and with heartfelt conversations about what is right and what is wrong. Because a lot of times it's not so clear cut in adolescence. It was easy for a school age kid to decide this is the rule, and it's easy to see which way to go. However, with adolescence, there's a lot more gray area. If you've got to think things through a little deeper, and even though it can be the same situation, such as the story I just reminded you of, it becomes more complicated. So it really helps to be able to talk through the decisions and really figure out what is best. And I kind of already went over how they would, in this age group, they're considering whether or not they espouse the values that they were raised with or not, and may question the status quo. They do, excuse me, continue to base a lot of their choices on their emotions. Okay, so Piaget, I think there's a video I needed to show you. Just a second. I guess it's coming up. So Piaget, he's his theory is formal cognitive development, and this age group starts into formal operational stage. And this is actually Piaget's highest stage that he came up with in his theory. And he says it's not something that just comes automatically, that it requires some training and some study. And with help and guidance, adolescents can progress into the formal operational stage. So basically what the formal operational stage amounts to is the ability to think abstractly. This is a huge step up from what the school age kids were, because remember, they were very concrete thinkers, whereas now they, as adolescents, they can think abstractly. So kind of have an image of what that means. A chessboard is a perfect example. So it means that they can think outside the present moment. So when you play chess, you're anticipating what, if you're a good chess player, you're anticipating what your opponent's moves are going to be. So you're looking into the future and applying logic. And again, you have to have good logic to play chess, and imagining the consequences of a hypothetical event. So the chess player is imagining, well, if the player moves this piece here, then this will happen. Or if the player, my opponent moves this other piece over here, then that could happen. So, and they know that whatever move they make is going to affect their opponent's next move too. So they're kind of looking ahead in all of these ways, considering different outcomes that could happen depending on how they make their move. The last point, though, is that despite their ability to think more abstractly and more logically, a lot of times they do lack good judgment, and we'll explain why that is in a little bit. It has to do with their brain development. And the lack of judgment oftentimes lets their peers pressure them into, or influence them into doing things that are really not good sense. Okay, so this is the video I was expecting to see come up. Sorry, I'm having to find it. Okay, so we are going to have our two more presentations. So before we do the hospitalization one, let's go ahead and bring Brooke and Marin on. And I'm going to bring up your PowerPoint while you come on mic and camera if you can.
Can you hear me, everybody?
Yes.
Marin, are you getting on?
Yep, I'm here. I'm ready.
Okay, cool. So we are doing tobacco and alcohol education, and ours is gonna be a little bit, so we are trying to focus not on adolescents using, but more on like younger children. So as far as age-wise, we're kind of stepping back for a second. You can go to the next slide. So we kind of wondered, our first question when we looked at this was like, what are the different kinds of tobacco? Like, does that just mean smoking, like cigarettes, or like chewing tobacco? So there's a list of different kinds that we found in the books and online and stuff. And so there's the chew cigarettes, there's e-cigs, cigars, hookah, and pipe tobacco. So you can go to the next slide. A couple of interesting facts. The first one was a little bit outdated, but 9.5% of middle school students and 25.6% of high school students currently use tobacco. And I'm not sure, I think this was just in the United States. This one was in the book and it was kind of old. But we found a newer one from the CDC that said 1,600 youth under the 18 smoke their first cigarette and nearly 200 youth under 18 become daily cigarette smokers. So we figured that was kind of a lot. And then you can move on.
Sorry, I went back. I went ahead too.
So the kind of like risk factors of youth using tobacco and different things we have listed here. So like lower socioeconomic status and income and education. Not knowing how to say no, lack of support or involvement from parents, accessibility, availability, and the price, doing poorly in school, low self-image or self-esteem, and seeing advertising and not necessarily commercials, but use of drugs and alcohol in movies and television, on the internet, and things like that. And then you can go on to the next slide. This is kind of where it more deals with children and like infants. So secondhand smoke causes more health problems in infants and children, including more frequent and severe asthma attacks and respiratory infections and even SIDS. During pregnancy, smoking results in more than 1,000 infant deaths, and studies show that older children whose parents smoke get sick more often, and their lungs grow less than children who do not breathe secondhand smoke, and they have more bronchitis and pneumonia. So just overall, like poorer health and more susceptibility to sickness. And then we can go on. So I thought a couple of these were super interesting. So the first one says that when nurses offer smoking cessation advice, smokers are more likely to quit as compared with smokers who do not receive such advice from nurses. So we, as nursing students and eventually as nurses, will have a huge part in helping people to quit if they so desire. And the last little paragraph there says that the majority of smokers want to quit and just need someone to offer the information and like the advice and stuff. So that kind of plays into it too, like that we actually have a huge influence on this. And then there's just some different methods there, like counseling and different things like that. Next slide, please. So this is our learning activity. This video is only like a minute long, but if you learned something, put it in the chat box while you're watching or whatever. And if the link doesn't work, then we can just tell you about it. It was super interesting though.
Let's see here.
It does a little bit with the peat, but it's not quite as impressive because these lungs are COPD lungs, cancerous lungs. The elastance is gone, so they'll stretch out, but then the recoil of them just snaps right back because there's nothing to help hold them open. So you can see there how fast they just like. I guess it goes a little bit. We've got a couple more over here. Let's see what this. Peak. And you can see when so inspiration, expiration, they totally deflate. And they're right back to where they were before we started. So now with the peak valve, how long they stay.
So I just thought that was kind of interesting because you could kind of see that the diseased lung was not like didn't recoil and wasn't as like stretchy. And then the healthy looking lung.
Sorry,
for the rest of Friday.
Sorry, that's my
automatically
in the
went
east,
to the next
sunny
thing. Let me
spells,
shut that
otherwise,
down.
especially in the south and the west, that's where high pressure is building in for the weekend.
Clicked
But
on
low
it
pressure
and
is still
went-
close by.
Okay, there we go. Sorry about that.
That's good. But yeah, so I remember seeing that in middle school, I think, or like high school. They brought in a set of lungs that was a disease set and then a healthy set of lungs. And it kind of just, that impacted me a lot then. So this was kind of something that I had in mind when I was thinking of like how I view the effects and things on the body from smoking. And then, yeah, we can go ahead and go to the next slide. So these are the 5 A's. They were listed in many websites and the books and everything. So ask about tobacco use every time that you're seeing a patient, and then advise to quit every time. Also, personalizing it to kind of guilt them into quitting is apparently one of our things we should do. Assessing willingness to make a quit attempt, and then assist in the quit attempt and arrange following up and holding the patient accountable. You can go on to the next slide. Great. So tobacco use is kind of the gateway drug to using illegal drugs and alcohol. So can go on to the next slide.
So when it comes to alcohol, no, it's not rubbing alcohol. There's a bunch of different types of alcohol that people can drink, but none of them at the end of the day are safe for kids. So you can go ahead to the next slide. So some really interesting statistics that we found. The first one is in 2019, the Monitoring the Future survey, External Icon reported that 8% of 8th graders and 30% of 12th graders drank during the past 30 days, and 4% of 8th graders and 14% of 12th graders binge drank during the past 2 weeks. So it's pretty crazy. And then in the next one says the 2017 Youth Risk Behavior Survey found that among high school students during the past 30 days, 30% drank some amount of alcohol, 14% binge drank, and 6% drove after drinking alcohol, and then 17% rode with a driver who had been drinking alcohol. So pretty scary stuff. Okay, next slide. So how does alcohol affect the body long term? There's a lot of short-term effects. You can potentially be put into a dangerous situation, but long term, it can cause high blood pressure, heart disease, stroke, liver disease, and digestive problems. There's a number of cancers that could come from it. You can have weakening of the immune system, so you could possibly get sick more often. You can have learning and memory problems. You can have poor school performance, and then later in life possibly develop dementia. And then there's mental health problems, including depression and anxiety. And then you could possibly become an alcoholic. So these are things to just teach kids about, so that they know that if they start drinking when they're young, or if they drink irresponsibly when they're older, there can be some consequences. Okay, next slide. So for children, if they were to drink it, it can be a poison to them. It can make their blood sugar drop really fast, and they could potentially die. So some things to remember is to lock up alcoholic beverages. You need to empty beer cans and wine glasses and drink glasses before children can get to them. You should store mouthwash and alcohol-containing cosmetics and cleansers out of sight and reach. And then if a child does swallow alcohol, you should remove it, and then you need to call poison control immediately. And there's some questions you want to be able to answer, including the name of the product, how much is missing, how long ago it happened, the child's age and weight, and whether the child is having any symptoms, and your telephone number so that they can stay in touch with you and get you the help that you need. Okay, so next slide. And so alcohol can potentially hurt children even before they're born. Fetal alcohol syndrome is a condition in a child that results from alcohol exposure during the mother's pregnancy. Fetal alcohol syndrome causes brain damage and growth problems. The problems caused by fetal alcohol syndrome vary from child to child, but defects caused by fetal alcohol syndrome are not reversible. So defects can involve the brain, central nervous system. There can be physical appearance and social behavioral issues. So it's important for us to educate mothers about drinking while they're pregnant. Okay, next slide.
So a lot of these things that parents can do to help prevent the use of tobacco also applied to alcohol, which was kind of interesting to us. So if we talk about it in a way that makes our kids feel not like they're being judged or punished, and just kind of having like a loose, not super uptight conversation about it is beneficial, and making sure your kids know that you're going to keep talking about it, so that they kind of will be held accountable. And then getting kids involved in sports and different things to just help distract them or to keep them from getting bored. And then helping them to not be respond to peer pressure. Focusing on what kids do right rather than wrong, and having good self-confidence. And then setting firm rules about what you're going to allow in your house, and what you're having strict rules against, and why, because that's important for them to know. And then you can go ahead and go to the next slide.
So what is the nurse's role in all of this? We want to make sure that we are educating a lot. We want to educate parents on warning signs in children's behavior if they are potentially smoking or drinking or suffering from the effects of it. We want to warn children about the unhealthy side effects and damage of body systems. want to educate parents and children on resources available to combat addiction and so that they can possibly receive counseling. And then while we're caring for them, we want to make sure that we're not judging. We want to just make sure that we're caring for them, letting them know that they have support and that there is a way to recover from it. And yeah, next slide. And those are our works cited.
Right, you did a lot of research. That was excellent. Again, excellent information, fascinating. Let's see, let's bring up, thank you so much. And thank you for reminding me that we missed that this morning because that was important.
We should have just not said anything. We should have just went with
No. So glad you did. Okay, so now I'll invite Leslie and Victoria up to come on mic and camera if you can.
Okay, can you hear me?
Yes.
And Victoria, are you here?
Yes.
Okay, so we're hospitalization on the adolescent. If you just want to go to the next slide. So we're actually going to start with the learning activity. If everyone could just put in the chat box like the first thing that comes to their mind when they think of adolescence. Moody. Impulsive, junior high, high school, attitude, self-conscious. Yeah, these are all perfect. Yeah, so actually all of these are like perfect. They lead right into what we're going to talk about. So if you want to go ahead and go to the next slide. Okay, so I found this picture and it's just teenager, a person whose sole purpose is to remind parents why some animals eat their young. And I think that just kind of goes along. I mean, it's a joke, but kind of like what everyone's saying, like it's late nights for everyone. They can be dumb, they can be dramatic. They're always involved with their friends, that kind of thing. So this is a time where they're going through a lot of change. I know some people talked about they're self-conscious. And they're very worried about their body image at this age. They do start to feel independent and they want to be independent, although they're still very dependent. I feel like it's kind of like they want to do everything on their own, but then like the stuff that's hard, they still want taken care of for them. They have a difficult time making decisions during this period. I saw someone that said like, I don't remember, impulsive. And they kind of think they're indestructible and can do anything. And Natasha talked about this a little bit, but they're searching for identity during this time. They're trying to figure out who they are. They're trying to be themselves, but they're not really sure. And she also mentioned this, they're testing their values and their beliefs, and they're kind of figuring out what they believe for themselves and not just following their parents. The next one. So there's a lot of changes with their communication during this time. So phones and technology are huge. I think we all know that. They're not afraid to argue. They're not just going to sit and listen to everything you say if they don't agree. Not all teens, but most teens are going to verbalize that. I kind of already mentioned this. They take risks and push things to the limits. They do sometimes hide their feelings. Like how they really feel if they are feeling self-conscious. I think a lot of adolescents aren't going to express that, so that's something we need to be aware of. They can understand humor, they can begin to compromise, although I'm sure that's not always very easy. Again, this was talked about, they are more involved with friends than family, or identify more with friends, and that's a big one that a lot of people mentioned. And communication can be difficult with them for that reason. Next. Okay, so as nurses, when we're communicating with adolescents, we need to be really, you can never belittle a patient, but you need to be really careful about if you tease them or not, because even if they may seem okay, they might actually really take that to heart, and that could really affect them. Because they have a difficult time making decisions, you just want to give them a few options at a time instead of just like dropping everything on them to help them make those decisions. And although they can't like legally make medical decisions themselves, you need to let them feel, because they have that sense of independence, you need to let them feel involved in their care. Just be supportive and encouraging. Make sure you're always open to communication, even if they seem like they don't want to talk. Just make sure they know that you're there to talk to them if they want to talk. You have to set limits for them, otherwise they're going to get away with whatever they can. Avoid arguments. You're probably never going to win an argument with an adolescent. And then just listen to them. I think a lot of times they probably feel like they're talking, but you know, the parent is always like, no, this is what we're doing, and they feel like they're not being heard. So as a nurse, just make sure you are listening to what they're telling you and take it seriously. And then just as a way to get them to open up, show interest in their activities and what they're involved in.
So for recognizing pain, I think it could be a little bit difficult with teenagers because, like everybody mentioned, they're pretty moody. But just like a shift from their normal would be a way to recognize their pain. They're more quiet, like more reserved, more in their room, more irritable and angry than usual. And they will complain about their pains. They'll vocalize it. Next slide, please. So for pain control in the adolescent that's in the hospital, you can give them analgesics. They recommend doing non-pharmacological treatments, so like providing comfort, you know, like give them a warm blanket, dim the lights, just try to make them as comfortable as possible. There's non-opiate drugs, opioids, and then regional anesthesia. Next slide, please. And then I included this slide because teenagers are very prevalent for being able to abuse and misuse drugs that they are given. They can misuse it by like sharing it with their friends, taking it when it's not supposed to be needed. I know like in psychology, we learned about how teens use cough syrup just to get that high. So they've been IDing people to get cough syrup. So I went to Walmart the other day and I got ID'd for cough syrup, and I thought it was the weirdest thing because I was like, why would anybody just chug cough syrup? But that is a problem to the point where they've made cashiers ID you for cough syrup. And taking drugs when you are young can contribute to the development of health problems in the future. And the drugs that are most commonly abused by young teenagers is alcohol, tobacco, and marijuana. Next slide, please. Okay, and then so for a coping strategy that you can use for the teen that's hospitalized is just be aware and address body image concerns. I did my first clinical at the emergency department, and I didn't think like body image would be that big of a deal. Because, like, I get it, you're subconscious as a teen, but I didn't think it was, like, such an important thing. We had a kid come in, and he had a lithium battery that exploded on him. So he had, like, second-degree burns all over his chest and on his arms. And I was, like, thinking about, like, the pain that he was in, and that would be his major concern. But one of the first things he asked was, am I going to look like this forever? Like, are these burns going to scar? Like, that was the major concern that he had. And the nurse addressed us like, no, like, you're young, we can heal it, we'll take care of it. And then he shifted his focus to pain after that reassurance. Like I said, they're very like self-conscious, so make sure to provide privacy, explain to them what's going on. They like to be treated as like a person. Like, I know that they're still minors and you have to like consult the parents, but they like to be included and they think they're very independent and knowledgeable. They can like tell you if their pain, so like communicate with them so you can treat them the best. And yeah, next slide, please. Okay, those are just we're excited.
Great. Okay, thank you. That was another excellent presentation. You guys included so much good information there. Thank you for all you put into that. Okay, so you covered this information very well, and so we are ready to move on to objective 3, which are the normal changes of adolescence. So adolescence is such a pivotal time of life. It's also a very vulnerable time of life because it's where they're kind of just coming into their own space, and there are so many changes happening with their body, with within their family, with their peers. And there's changes happening in the family just because of the way they're pushing away from their family. And it is the transition time, obviously, from childhood to adulthood. And maturation education does help with those physical changes so that they're more prepared for them and can deal with them a little better. Okay, so you guys have I made a table that you've got in your slide, in your presentation, that covers the information that we're going to go over in these next 3 slides. So I've divided it up into early adolescence, middle, and then later adolescence. So early adolescence are the tweener age. So basically 11, 12, 13. This is when they have that growth spurt, and it's also known as puberty or pubescence. So puberty is early adolescence. It's that growth spurt time. And as I said last week, that it happens in girls about 2 years before it does in boys. And so it starts with the growth spurt and it ends with reproductive maturity. And as far as that's the physical part, the cognitive is they've got that concrete thinking still, and so that limits their decision-making abilities. And then psychosocial is they're really focused on fitting in with their peers. Middle adolescence is 14 to 16, and the physical changes here are, so remember, early adolescence or puberty ended with reproductive maturity. So that's where middle adolescence begins, is with that reproductive maturity. And that is defined very specifically as menarche, or the onset of menstruation in females, and sperm production in males, which is the evidenced by the nocturnal emissions, which are also known as wet dreams. And also physically, they become attractive to their peers. And then their cognitive thinking is now they're able to have that abstract thinking. And they also feel invincible. This is a hallmark of the age, is they feel invincible. So they're really attracted to risk-taking behavior. And they may physically appear to be grown up, but they still lack good judgment. And they can't really function fully in an adult. I'm not going to say never, they would never be able to function fully, but it's harder for them to function fully because they lack good judgment. And then psychosocial is they still need that acceptance from their peers. Just like they wanted to fit in when they were younger, it's important for them to feel accepted. Excuse me, I was going to sneeze. It's just threatening. It's not really going to come. Okay. Then there's late adolescence, which is 17 all the way up through 21. According to your book, although we're calling adolescence for this unit as through age 18. So physical growth is Actually, this isn't from your book. It's from the article that I got this information from. So yeah. So technically, 18 through 21 is, or 17 through 21 is late adolescence. But okay, physically, they're fully developed and can function reproductively, and late adolescence ends with the cessation of growth and emotional maturity. So that's why they have this pushed ahead into 21, just because most 18-year-olds still aren't quite all the way finished with their growing and probably not fully emotionally mature. Their cognitive thinking is, they are able to develop critical thinking skills and realistic goal setting, and their psychosocial is, they're now future oriented. They're looking ahead to what they want to do in life, like going to school, getting a job, relationships. Okay, so major changes are obviously the primary and secondary sex characteristics are developing. So primary sex characteristics are the maturity of maturation of the gonads. So that's testes in males and ovaries in the females. And this lists the hormones that contribute to their maturing. And secondary sex characteristics we'll get to in a minute. Part of that, the maturation, is involves glands. So we're going to talk just a minute about the glands. So the sebaceous glands become more active, which causes a lot of teens to experience acne. And then the apocrine glands are the in the armpits. They are the ones that are a little bit odoriferous and involved with perspiration or sweating. And then the pituitary gland is another important gland that directly contributes to the primary sex characteristics. So the pituitary gland is also known as the adenohypophysis, and the anterior lobe of the pituitary secretes the primary gonadotropins, if you remember from our earlier unit, which are luteinizing hormone and follicle stimulating hormone, and these stimulate the gonads to become capable of reproducing. And then here we've got the secondary sex characteristics. So in males, they include the pubic hair. Both sexes have pubic hair and axillary hair. Men also get chest hair and facial hair. And their larynx and vocal cords grow, which causes their voice to deepen. The skin thickens, and then the sex organs are enlarged. Whereas with females, they get the mammary glands developing, and they develop a figure, so they've got more curves with the fat distribution changing a bit, and the breasts developing, and the hips widening. And again, the rapid growth, a lot of times, usually what we think of when we talk about their growth spurt is their growth in height. And it's pretty dramatic, but it varies greatly, as you can see here. Again, you don't need to memorize these numbers, but you can see that there's a large variety in how much they grow, and males tend to grow more than the females do. Okay, so physical changes, the body parts grow at different rates, making the entire body temporarily out of proportion. First, the feet grow. So the feet are awkwardly a little bit large in comparison to their body, which seems like a really good reason to put a picture of a hobbit on the screen. And but eventually they do grow into their feet. There's kind of a wives' tale that you can tell how tall an adolescent or pubescent boy is going to be by looking at the size of his feet. If his feet have grown way long, then he's going to shoot way tall. And then after the feet grow, then the legs and trunk grow to match. Additional body systems that we're going to talk about. So cardiorespiratory, mostly this is just saying that their heart rate and their respiratory rate continues to slow down a little bit. So it gets to be just essentially what you would normally expect for an adult. And they have increased ability for increased performance, both with cardio and respiratory, which helps them with their athletics. GI, I'm sure you are all very well aware of the increased appetite that teens have, especially the males, because they are growing so much, gaining so many pounds and inches, and they need to eat a lot of food to keep up with that growth. And problem is sometimes they want to keep up eating a lot once they reach their full height, and so they've got to remember that once they're adults, they don't need to eat quite as much as they did as adolescents. But so they have increased dietary needs, and we'll talk about that in nutrition. Neurologic. Now we're going to talk about why they have that poor judgment. The adolescent brain is hardwired for taking risks. And the reason why is twofold. One is that remember we talked about earlier the myelination that happens in the first couple of years of life. It is the brain, the prefrontal cortex of the brain is becoming myelinated in adolescence. So up until the time it's fully myelinated, that prefrontal cortex of the brain is not working perfectly. So what we call that prefrontal cortex is the executive functioning center. And that we call it that because it is responsible for planning and prioritizing and risk appraisal. And since teens do not have a fully functioning executive functioning center, they are going to have limited capacity to do these three things. Also, let's see. Also, they have more of when their reward center is extremely sensitive to input or stimulation. So the rewards feel bigger and stronger and better in adolescence than they do at any other time of life. So they are really things that they might be willing to make risks for are that much more enticing to them. So that's the second part. I told you that they made risky behavior for two reasons, and these are the two reasons. Immature executive functioning center of the brain, or prefrontal cortex, and then that their reward center is easily activated. And then males have one additional component in that testosterone enlarges the amygdala, which leads to even more emotion-driven impulses. Okay, so cognitive changes are abstract thinking and increased concentration to follow complex instructions. Their motor skills, they become even stronger and more adept, faster. They can function with greater speed, and their fine motor skill, they develop even more better, improved dexterity and accuracy for the fine work they need to do, and then gross motor skill is improved strength. Okay, so you need to remember this little bit here is that their large muscles grow faster or become more mature faster than their fine muscles. So what that does is it makes them temporarily have decreased coordination. So once their smaller muscles catch up to the larger muscles, then they will be even more coordinated, but they do have this temporary decreased coordination. And you kind of maybe have noticed that in adolescence that they can be a little bit klutzy, and this is probably why, in most cases why. But they will, it's temporary. Don't worry about it when you see it in teens. They'll get that sorted out. Sensory development, they've got precise hand-eye coordination, which a lot of them use very well with different gaming, video games and things like that. They may develop myopia, which is nearsightedness related to growth spurts, and they're good at throwing and catching and aiming and things like that, which helps them to be even better at sports. Language skills, their vocabulary grows hugely in adolescence, and part of that vocabulary is developing, a lot of them develop their own slang. Oh, I should have had a video, the video ready. I'll see if I can find it for maybe tomorrow. There's Seth Meyers did a video of the slang that teens came up with for COVID, everything COVID, and it's hilarious. I'll see if I can find that and share that tomorrow. Verbal communication is used to help them to argue. They're great debaters. I love how Leslie said you're probably never going to win a debate or an argument with a teenager. And it's true. I just listened to a great books, a person who did all of the scientific research on teenagers, and he just basically said the same thing, that teens are really good at arguing their case. And adults need to encourage their free expression and listen and exchange opinions with them. So it's shifting their emotional attachment from their family to their friends as adolescents. And the thing that's important about families at this point is that it's where teens can place their blame for what's wrong in their lives. So that's the whole point of having a family, is so that you can say that it's their fault. They like to test their values and beliefs, like we've been talking about, and these include their style of dress, their style of hair, if they have any piercings or tattoos, and they really resent authoritarian methods with them, because they don't want anybody, they're not going to buy into an authoritarian telling him it's this way because I say so. That's just going to invite one of their awesome arguments against it. And emotions are very, like somebody put in the chat box, they do tend to be emotionally driven and dramatic. I like how Megan put it there, dramatic. And they've got extremes of emotions, and everything is big. And if it's exciting, it's like way exciting. If it's horrible, it's like just the worst thing that could ever happen. Ambivalence. So ambivalence is having feelings going both directions at the same time. And this is because examples of these are that they love and hate their family at the same time. And they want to fit in, but yet they want to be independent. They want their freedom, but they need support. And it can be a really trying time as a parent. And a lot of parents joke about it. They joke about how difficult it is raising teenagers. And I think they joke about it to make light of it, because if you can't laugh, what are you going to do? But I remember when my kids were teenagers, I just was like, all those parents that joke about how hard life is with teens, they really meant it. It wasn't just a joke. Anyway, they seek group. I need to point this out, that it's super important for parents to be willing to take the brunt of the teens pushing away and blaming them for things, but still love them through it and still be ready to support them when they need it, even if they are trying to push away. So they seek group acceptance. They feel self-conscious, and it's very easy for them to feel alienated. If they're looking on social media, if they see some of their friends or even all of their friends get way more likes or shares or friends comments, responses than what they're sharing, they're gonna feel like they're less than, and that can be a hard thing for them. It helps them to feel secure if they are well supported. So having good friends helps them to have a better experience through adolescence. So every parent and caregiver wants to help support their teenager to get a good support system, a good group of friends. Okay, this is just a little thing for the fun of it. These are things you learn about Siri when you're chauffeuring teenagers. So these are actually things I personally learned about Siri by driving my daughter and her friends around. So this isn't my daughter. This isn't a picture of them, but it's the one I just found on Google Images. But okay, so this is Siri's answer. No one cares what you look like in the cloud. So what do you think the question was? No one cares what you look like in the cloud. That would be a good one. Yeah, oh, those are good. So this was the question. Has anyone ever told you you're ugly? Okay, so maybe these were early teens, pubescent teens. Okay, the next question is, I'm not in a relationship right now. So the question there is a little bit more obvious. Do you have a boyfriend? And then here's the last one. My personal taste is rather unconventional. I doubt you'd like it. Oops, I went forward too far. What's your favorite? Oh yeah, you got it, Brooke. What's your favorite song? Okay, so relationships with parents. Just we've kind of been talking about this all along. They're pushing away, finding fault, tend to be argumentative, wanting to contradict or to reason things the way they see them, not necessarily the way their parent has been teaching them their whole life. So parents do need to continue offering that unconditional love and support and acceptance. Their body image is huge to them, as Victoria, I think, was telling us the story of the emergency room. That's a great example of his biggest concern was scarring. So that's a great example of how important their body image is. So they're super concerned about their appearance. and they tend to see themselves negatively. Like, just the most beautiful teenagers can still find, I mean, things about them that they're just horrify them, about their appearance. And again, appearance, excuse me, are super important. They like to talk to peers to see what they're thinking, how they would do things. And it helps them with establishing their own identity. Sexuality, this is a critical time because they do have increased and sometimes very strong interest in the opposite sex, and they oftentimes will question their sexual orientation. Speaking of which, so here's, I'm going to do a poll. So to you, sex is which of these? Binary, you're male or female. Multiple choice, you can be a cisgender or transgender male or cisgender or transgender female. Select all that apply, all of the above plus your orientation, homosexual, bisexual, heterosexual, lesbian, pansexual, spectrum or D, spectrum, anywhere, depending on the mood, a gender fluid, uncertain. Agender. And I can't see any of your responses, so you're welcome to see anonymously put in what you think. Well, there's a few more of you who haven't taken, who have not voted yet, but I'll go ahead and publish this and move on. So most of you, actually over half, see sex as binary. All right, so let's look and see how this age group use it. The percentage of the general population that's lesbian or gay or bisexual is 3.5%, and 0.3% are transgender. However, looking at the adolescent population, 20% are LGBTQ and 2 to 3% are transgender. This surprised me. Only 48% of adolescents view themselves as exclusively heterosexual. So if I were to do this poll with purely adolescents, we probably would have, probably wouldn't have seen as many who, a larger percentage would have been down on the C and D rather than up in the A and B. So I think part of that, this not viewing themselves as exclusively heterosexual, is summarized really well. A friend of was telling me about how she was probably, I think she was chaperoning a bunch of kids, and she heard them talking about, are you gay? Are you bi? Or are you just, they were all just asking each other how they felt about these different sexual orientations. And she said her daughter chimed in with, well, I'm bi-curious. I might not be bisexual, but I am bi-curious, just wondering how it would be. So that's probably what a lot of that 52% who are just wondering, just holding the question out there. What am I? I could be anything. So health concerns for the adolescent LGBTQ plus population is that they tend to avoid seeking medical treatment because they feel like they are judged. and they feel there is a strong bias against that that group, and they also feel uncomfortable, especially if they're transgender. They are feeling like they're transgender. They might feel really uncomfortable with their bodies and not want to expose their bodies to medical personnel. They are 5 times more likely, that's a 500% increase, more likely to have 2 or more mental disorders, such as depression, and oftentimes depression is one of the 2 disorders. They are 34% more likely to be bullied and 20% more likely to experience sexual violence. And so this is just good to be aware that there's a growing population of adolescents who are feeling reluctant to interface with the medical field because of feeling judged. So it's important as health care providers that we are open and inviting to all people, no matter what their background, no matter what their culture, their whatever. We want to be open and inviting so everyone feels welcomed and can be supported and helped and receive good medical treatment. And so since there are such a large percentage of the population, of the adolescent population, do identify with a spectrum of these sexual possibilities, they should be routinely asked what their sexual orientation and gender identity is. And if they are gender non-binary, it's helpful to ask if they have a preferred name or pronoun. And I actually, when I was giving blood a while ago, one of the attendants who was asking the questions, he asked me that way, do you identify as male or female? He didn't take it for granted that I was identifying as female, and he did ask me those things, and at first I thought it was kind of funny, but now I really respect that, because that's kind of the direction, and I don't know if some people are going to feel uncomfortable with that, but maybe older people would. But adolescents, I think you're safe asking them that, and they'll just think it's cool and being respectful. So nursing implications, let's see. Oh, I already covered that on the previous slide. Okay, so objective number 4 is common issues. So depression is huge in teens. It's increased significantly in the last few years, and the definition is prolonged feelings of intense sadness. And you guys are covering depression in 1025, so I'm not going to go into detail on this at all, but just how it relates to teens is that they tend to be at higher risk for depression than their younger, than the school age kids, because they have overwhelming demands from school and work and peers, complicated relationships with family and peers. And it also tends to be a really self-reflective time where they're looking inward and feeling disappointment or despair. And it helps if they can kind of turn their focus and look more outward instead of being really super focused on themselves. But adolescence is a time where there's a lot of self-reflection. Teen suicide, again, this is something that you've covered in 1025, but we're just going to say specifically how it relates to teens, because it is one of the leading causes of death in our area, Utah. It is the leading cause of death. And So here are some things to be watching for: substance abuse, behavioral problems, withdrawing from family and friends, changes in sleep and eating habits, neglecting hygiene and personal appearance, unexplained physical complaints, difficulty concentrating, loss of interest in things that they were previously interested in, and that could be either school or work or activities that they, sports, no longer participating in these favorite activities, risk-taking behaviors, giving away possessions, writing a suicide note, expressing suicidal thoughts. So all of these need to be taken seriously. Violence. Okay, homicide is associated with alcohol use, and sadly we do see it in teenagers. 60% of teen homicides are committed with firearms, and 60% are also males, and Blacks are 10 times more likely to be victims of homicide than other races. Bullying is also can be violent, and as was excellently covered earlier today when we were hearing about bullies, it's a problem for both the victim and the perpetrator. And I think it's good. I need to add to this, even the bystander is affected. So thanks for pointing that out. Let's see. Dating violence, more specifically. So there's a lot of emotional and physical and sexual violence associated with dating. And stalking is considered a type of dating violence. And it can occur either in real life, I mean, I shouldn't use real life, in physical connection where you're actually sharing the same airspace, but it can also occur electronically. In fact, there is a really, I don't want to get into sad stories. Anyway, I'll just leave it at that. It can happen electronically as well, such as cyberbullying, but there's the cyber dating violence, like if somebody's pressuring somebody to show up, to share a picture of themselves, an inappropriate picture of themselves, and anyway, things like that. Effects of dating violence are depression and anxiety. Victims of emotion. So victims tend to be females, more commonly females, and they also tend to avoid bonding with intimate partners later on in life. So a lot of healing has to happen for them to be able to have the trust to bond full-heartedly with somebody else later on. Other effects are eating disorders, substance abuse, suicidal ideation, and chronic pain. Just a word about date rape, drug, they can add to drinks, and then it causes them to kind of black out, and they don't have any memory of any sexual attack they might experience while they're under the influence of the date rape drug. So it is illegal in the United States. And nursing implications are to teach skills to create healthy relationships and to reinforce that the violence is not their fault, even though sometimes it feels like society tries to pin the blame on the victim. It really is not the victim's fault. Although there are things the victim, that people can learn to do to help minimize their risk. So we want to instruct about those, which I'll get into more later under dating safety. So gangs, we do have gangs in this area. We used to have somebody from the Metro Gang Unit from Ogden come and give a 2-hour presentation on gangs, which we don't need to spend 2 hours on it. You guys aren't missing because of the COVID virus. They're not coming out to do those presentations anymore. But I can summarize in just a few minutes what they covered. It took 2 hours to cover. But we do have gangs, and they have their territories and their markers, which are tattoos and graffiti, and their colors, and they do look. The kids who are more likely to join gangs are mostly it's because they're growing up in the gang culture. So maybe they've got family members already in gangs. And another reason why they might join is if they feel threatened and they feel like they need to have a gang to be their safety for protection. And usually, according to the guys who come out from the gang unit, usually it's when they don't have strong parental involvement. So if kids who have the uninvolved parenting, those kids are more likely to end up in gangs. So as long as they've got a good family support system, it's not very likely at all, unless the family's in the gang. It's not very likely at all that they would end up in a gang, but it's good for parents to be aware. So risk factors are living in an area of heavy gang activity. You can kind of see that if there's a lot of graffiti or some of the, they've got gangs everywhere. They say that there's gang involvement in every school, even every elementary school. So there's not anywhere that's fully protected, but there's the risk is low that they'll be targeted. Kids will be targeted as long as they've got a good social structure, good social system. And let's see, unstructured time. So if the kids are just out on the streets, hanging out with whoever, they're a little bit more likely to be targeted by gangs and befriended and taken in under the wing of a gang. And kids who have low self-esteem. So let's see, signs of gang involvement are unexplained money, if they're in the drug part of the drug thing. So some kids are motivated to get into gangs just so that they can be involved with getting drugs and getting the money from selling drugs. Wearing clothing of all one type or color or style, using hand signs, withdrawing from family, associating with known gang members, possessing drugs, and carrying weapons. So one thing that the officers would say when they would come is, they say, if you see anything gang related going down, do not get involved. Just call the cops. And however, you are safe to take a video, because the gangs like to have their strangely don't say, hey, they're taking a video, there's going to be evidence of us doing this crime. It's like, hey, they're taking a video, maybe we'll get some airtime. maybe that somebody will post us on Facebook. They like the fame and notoriety of having something that they're doing gang related getting out there. So they're not going to come after you to destroy your evidence if you take a video. And it does help the cops if you take a video, so that they have some things that they can be looking for to identify what's going on. And they're really familiar with the gangs and the gang members and the types of things that they do. And yeah. Any questions about gangs? Because I've heard so many of these and so many questions, I could probably fill the questions if anybody does happen to have any questions. So, but what I've shared is all you need to know for this class, for this any test-free associated with this unit. Okay, social media, and this has been talked about already, so I'll just go over this very quickly. It's teens are really influenced by their peers, and social media is how they interact with their peers, so it's important, and they spend a lot of time on it. They may have unrealistic expectations, and so it can be hard or disappointing for them. 24% of teens spend the majority of their day on social media. And this is not an uncommon sight to see a bunch of teens just, instead of interacting with each other, they're on their devices. And they very possibly could be interacting with each other. Maybe they are texting the person sitting right next to them. But that's just how they do it. And a benefit of social media is that they can feel supported, and I have seen that as a positive thing. And you guys learned about dysmorphic body dysmorphic disorder in Wendy's class. But what she might not have mentioned, at least in the past, she hasn't mentioned this. So is this new to you guys? Snapchat dysmorphic disorder, where the teens use a filter on something like Snapchat, and they use the filter to change their appearance, and then they'll want to have a surgery done. They'll take it to the doctor and say, hey, can you make my face look like this? And there was so much of that going on that actually Instagram has deleted its filters that could be related to. I'm looking up the name of it really quick because I can't. They banned their AR filters, which are the augmented reality cosmetic filters, because there were so many people who were wanting to have plastic surgery so that they could look more like their Snapchat filters. So now the filters are, at least with Instagram, are way out, not anything like lifelike. So I'm sure you guys have all seen the different weird filters. If you were a teenager, or if you have ever lived with a teenager, that's how I know about Snapchat. Anyway. Often the desired results are surgically unattainable. Okay, substance use, and we've just had a great presentation on substance use. So some of this I can go over really quickly. But the two driving forces for teens using substances are that risk-taking behavior, like I talked about earlier, and also the need to fit in, which is so important. If their peers are doing it, they're going to want to do it, generally. However, the teenage brain is more susceptible to damage from alcohol. So it's important to try to get teens to not drink as teenagers. And I know when you're a teen, if they have to wait a whole day, it seems like forever, like unreasonable. Tell a teen, wait until you're 18 to drink. And that's just going to sound like so unreasonable to them. But if you explain reasons why, because you want your brain to be functioning your whole life at its peak performance, and the alcohol damage is damaging to the brain, and they'll probably argue back. There's plenty of people who had drinks as teenagers and do just fine, and you can argue back, well, you don't know how much smarter they would have been had they not had been exposed to alcohol as teens. These things were mentioned. Why teens use are to escape, and again, peer pressure, and also to rebel against authority. So use of alcohol is often accompanied by irresponsible sexual behavior and such as promiscuity, which puts them at risk for sexually transmitted diseases and pregnancy, which those things really complicate life. So you just want to help the teen avoid going down that path. And let's see, substance abuse occurs when consuming substances interferes with day-to-day activity. So that's abuse. The difference between use, where they just use occasionally, even that isn't good, but substance abuse is far worse. And there is a trend to mix alcohol with caffeine. I don't know if I'm going to ask you guys to put in the chat box anything on this next slide or two, that including this one that we're on now, that is new information for you. So just put like mixing alcohol and caffeine. So the thing that happens when they mix alcohol with caffeine is the caffeine makes them more alert. So they have more of the sensation that they are with it. Let's see, but it's just an illusion of sobriety. They are not actually more sober. They don't have any better judgment. So they think like, oh, if I take caffeine with alcohol, I can be more alert and actually drive after when I drink. But that is not the case. They don't have any better judgment. And counseling can help with addictions. All right, so just type in the chat box any of these that are new to you. So eyeballing, these are non-oral routes of alcohol consumption, which I was pretty surprised to learn about when I first pulled up this information. So they actually intentionally pour alcohol into their eye as a way of consuming the alcohol, which is very damaging to the eye. Smoking or inhaling the alcohol mist, which is a vaportini. Vodka tampons. So they take a tampon, and tampons are not just for females anymore, because the males can use them. They can go in the vagina or the rectum, and they call them slimming because you don't have the calories from consuming the alcohol. IV injections of alcohol, and alcohol enemas called butt chugging. Leave it to a team to come up with a name like that. So, yeah, these are crazy things to do to your body. The reason why teens use these non-oral routes of consuming alcohol are, it actually can cause them to become intoxicated more quickly. And they don't have the alcohol on their breath, decreases the calories, and they don't have that hangover or the vomiting symptoms. However, they are extremely harmful. It's if you're going to have to have alcohol, the oral consumption is the best way to do it, because all of these are damaging because they bypass the liver. So the liver doesn't help clear the toxins. Also, since they're bypassing the GI system. The GI system, if you go overboard, if you have too much, people who drink too much tend to vomit, whereas you don't get that if you're butt chugging. You're not going to vomit it out. But I mean, they're not going to hold it forever, but they hold it long enough. So there's increased risk of poisoning, and it can even require hemodialysis to clear the alcohol from their blood system. How crazy is that? So a lot of times if you ask a teenager, are you drinking alcohol? If they're consuming it non-orally, they're going to say no. So you have to learn to ask them about their alcohol consumption, including non-oral routes, because they're so creative. So commonly abused drugs are the Molly or ecstasy, which is a party drug. Tobacco. e-cigarettes are just taking off with teens. I mean, that's one of the reasons why they're trying to limit the number of flavors, because there's just so many reasons why vaping or using e-cigarettes are enticing to teens. One thing, these are the e-cigarettes, and they just look so sexy, right? They look a lot cooler than a regular cigarette does. And they might not even look like a cigarette at all. A lot of them look like flash drives, and so they can have them there. And unless the parents or the teachers are aware, they won't even know that they're vaping. And there's not really the odor, so they can get away with it without getting caught. Let's see. It's easier to overdose on the nicotine. So in some ways it's safer. That's why they allowed a new type of I think they're FDA approved. I'm not sure. I should double check that. Our e-cigs FDA approved. Yes, they are. They have extended regulatory power over them. But they're banned for minors, so they are not approved for minors. And they're also trying to get rid of the flavors. But anyway, the reason why they were seen as a good thing is because there are actually less chemicals and toxins in the e-cigarettes than there are in than in traditional cigarettes. But they can get more nicotine. They do have nicotine, and they can get more because there's a whole pack worth of nicotine in a single cartridge of the Juul. And so, when you smoke a cigarette, there's a natural end point when you get to when the cigarette's gone. Whereas with something like a Juul, they can consume a whole pack's worth of nicotine before they get to the end point. So there's also, it's a finer mist, so it goes deeper into the lungs. I don't have that on your slide, but it's just, and it also uses, have you guys heard of popcorn lung? People who like work in movie theaters who are around popcorn a lot, they can get the chemical in their lungs, and it's harmful for the lungs. That same chemical is in the formula for the e-cigarette, so it can cause popcorn lung too. So eventually they might have to change the name from popcorn lung to e-cig lung, whatever. Other types of abused drugs are opioids. Oh, I skipped over the fact that nicotine is harmful to the developing brain, so you don't want minors to be exposed to it. Over-the-counter drugs can also be harmful, just like was it Brooke or Marin was talking about the cough syrup that they can consume. So to get just a little bit of a something, a little bit of a buzz, or so. There's all of these types of over-the-counter drugs that, when taken in high quantity, can cause types of euphoria or psychoactive responses. And a popular game with teens now is Skittling. It's where everybody comes, they just go to before they go to the party, they go to their home medicine cupboard, and they just sweep what's in there into their bag, and then they bring it, and everybody dumps what they brought into a big bowl. They mix it up, and they pass it around until it's all gone. Everybody takes a handful, and they keep passing, and you just take whatever mix. And so again, they're just being creative and figuring, let's do an experiment, see what this does to my body. Anyway. Yeah. So commonly abused drugs continued. So prescription drugs, boys misuse to get high, and girls, and this is generally speaking, tend to misuse to lose weight or to stay alert. Caffeine is a really popular in drinks, obviously, but teens also like to get the caffeine gel strips, and they're designed to be consumed one at a time, but they like to take a whole bunch all at once to get a caffeine buzz. And they can actually experience caffeine intoxication, which the signs and symptoms are listed here. And an overdose would cause respiratory failure and seizures. And then cannabis, marijuana. Exposure to marijuana before the age of 16 increases the risk for frontal lobe brain impairment. And I just talked about how important the frontal lobe of the brain is. That's the executive functioning center. So really try to discourage teens younger than 16 from using cannabis. And then, of course, okay. So then there's the synthetic cannabinoids, which come in these little packets like this. They are made from plant material that's treated with chemicals that are not cannabis, but work on the same brain receptors as marijuana does. And it so happens that these chemicals are a small dose of rat poison. So it can cause coagulopathy, because that's how rat poison works. So they're terribly unsafe. These are way worse than even marijuana or the real drug. And they are illegal. They are not FDA approved, but they get around selling them because if you can see on here, it says not for human consumption. So they print that on the package, and that makes them safe for them to sell it. But they know full well that humans are going to consume them. That's the whole point of purchasing them. And they provide psychotic episodes, respiratory depression, withdrawals, and they affect the brain more powerfully than the natural cannabinoids. All right. Probably cheaper. I wouldn't say it's the rat poison is safer, so I'm not going to go there, but excuse me. Inhalants, things like glue, spray paint. This is the wrong picture, but the reason why I don't have an accurate picture of inhalants is because it's so disturbing. When I went to Google images and put in inhalants or huffing, the images that came up were just so disturbing. I just shut it right down. But I didn't even want to look and see if maybe there was one that wasn't disturbing. But yeah. Abuse causes decreased ability to release endorphins. So that means they get more addicted and they have to repeat and reuse to get anything, to feel anything at all. So it's a really bad cycle to get into. Gives them decreased ability to feel pleasure because of the decreased endorphins, causes mood imbalances and more susceptibility to pain. So it's just bad news. Don't go there. Don't encourage teens. I know you guys aren't going to, but encourage teens not to go there. So the high they experience is really short-lived, so they have to reuse frequently, and so their nasal cavity can become inflamed, and it can cause increased blood pressure and heart palpitations. And signs of misuse are a rash around the nose or mouth, inflamed nasal cavity, academic decline, weight loss, and a chemical smell on the breath. And then, of course, teens are also experimenting with sex, oftentimes. Not, I don't have the statistics, but it's, maybe I do on my PowerPoint in my notes section. But. Yeah, it's a pretty high percentage of teenagers who are experimenting with sex as teens, and so we want to teach them safer sex. I'll talk about this in STIs, but there's no such thing as absolutely 100% safe sex. So instead of teaching safe sex, we teach safer sex, and these methods include abstinence, birth control, and condom use. And then, of course, the risks are sexually transmitted infections and pregnancy, which I mentioned already, but if a teenager gets pregnant, it really interferes with the progression of life. They're less likely to get, or they just have an uphill battle to get the same amount of education as their peers who didn't get pregnant had. Some teens are actually actively seeking pregnancy because they want somebody to love unconditionally and who will love them unconditionally back. I used to work with a nurse when I was working labor and delivery. There was a nurse who worked part-time on the weekends whose regular job was as an office nurse in a GYN clinic, OB-GYN clinic. And she said there was a group of teens that every single month they would all come in together. She said there were like 3 or 4 of them. They'd all come in together to the office to get their monthly pregnancy test. And there would be like, oh, I'm not pregnant. They'd just be so disappointed every time that it was negative. Or if one would get pregnant, they're just all so excited for them. Yay! You know, it's just kind of a weird thing that there is a need there for some teens who want that love and attention or whatever that would be associated with pregnancy. But teen pregnancy it's higher risk, and it sets them up for a lifetime of disadvantages. So. Okay, challenge videos. Yes or no? Poll. Have you seen a challenge video come up on have you been challenged? Have you received a challenge? I'm not asking if you actually participated in one. I'm just asking if you've received a challenge through Facebook or Instagram or something. The ice bucket challenge was so popular a while back, and I know I saw so many people who took the bait with the ice bucket challenge. There was the cinnamon challenge, the hot pepper challenge. I'm going to go ahead and publish these and show the video. So most of you have been a challenge. I'm not going to ask you if you actually did it or not, but if you want to type in the chat box the different types of challenges you've received, that could be fun to watch. And I'm going to share a video about why people do challenge videos. Thanks for posting the challenges. That was fun reading about your challenges that you've had or seen. And while we were watching that, I looked up the statistics on the percentage of teenagers who engage in sexual activity is 55% by the time they're 18. So it is more common than not. This is just an FYI, just something that just to be aware of. There is a thing called female athlete triad, which is also, they're trying to change the name to relative energy deficiency in sport, or REDS. And they want to change the name so that they can include males as well, because males can have some similar outcomes. So what it is it's basically an energy deficit where teens are consuming less in calories than the energy than what they're expending in their exercising. And for females, they can exercise so much that they do not menstruate, and that combination can cause a loss of bone. And once that bone is lost, it's really hard and sometimes unachievable to get the bone mineral density up to where it should be. So they're trying to help people to be more aware so that they can prevent the bone damage from happening. And it can be accompanied by eating disorders, but it doesn't have to be. So it could just be that they're exercising hugely. They don't have an eating disorder, but they're just exercising so much they're using more calories than they're consuming. Okay, and then the opposite would be obesity, where they're using less calories than they're consuming. And this has some serious consequences. And we've talked about these already, so I'm not going to read the list again, but you've got it there in your notes. And the causes are the same as what we've been talking about: genetics, behavioral, sedentary lifestyle, and overeating. And this chart shows from the 60s until recently, the percentage of the population in these various age groups that are obese. And you can see that there's been a steady incline in obesity, in childhood obesity over the years. So we're definitely moving in the wrong direction as far as that goes. So here's some nursing anticipatory guidance. And this time we're providing it to not only the parents, but also the teens. So up through all of these age groups, we've been focused on providing anticipatory guidance to the parent. But now we need to include the teens themselves. So the choices that teens are making are going to really impact their future. So if they're developing, if they're using drugs and alcohol that are going to damage their brain, that's clearly going to have a long-term consequences. They're making choices that are developing habits. So the habits and choices they make as teens have long-term consequences. So we need to really be proactive with teens to help them get off to a strong start as they move into their adult years. So we always want to be non-judgmental and help them to feel safe so that they can open up. And we can teach parents to do this too, to always be listening and ready to asking questions. The more open a teen is with their parents, the more studies go, the more the happier they will be in life, and the more likely they are to make decisions that will put them on a path of the best possible outcomes. So we do want to encourage teens to be open with their parents, and parents to be open and accepting with their teens. and and that we're open and non-judgmental of both parties, the parents and the teens, and to assure that that we can be confidential with them. So usually we'll want to allow the teen to have some private time talking to their healthcare provider. So it's fine to have the parent there at least through part of any interview or teaching or examination, but you do want to invite the parent to step out at least for some portion of any interaction you have with a teen as a medical healthcare provider, because teens are possibly going to share things with you, be more open to share things with you if the parent is out of the room. And at the very end of this, I'm going to share some of the teens' rights as far as medical care goes, and so you know what their rights are. But they do have a right to privacy. Start by showing interest in what's going on with them. So be genuinely interested in asking about what's, oh my goodness. Sorry, I had done a do not disturb on my phone, but it must have expired. Okay. Let's see. Where was I? Was talking about showing genuine interest. So find out what types of things are important to the teenager, and then let's see, offer facts about benefits about their behavior. So you'll want to ask them specifically. I think it says down here to ask them if they are consuming alcohol, even non-oral, specify non-oral routes. And because they're not going to volunteer it usually, or engaging in sexual behavior. Even if you don't perceive that they're at risk for a problem, just be specific and ask them. Otherwise, they're not going to share what's going on. So as I was saying, you're going to want to find out what types of behaviors that they're doing. And if they are engaging in risky behaviors, this is the ironic thing that actually works really well is if you hear about, for example, non-oral routes of alcohol consumption, you can say, oh yeah, I've heard that there are some advantages. Don't put it that way. That sounds too official. Yeah, I've heard that that's getting popular, and that there's some reasons why teens like to do that, maybe because they don't smell it on the breath, or you can list the advantages of the risky behavior, and then because this is what the physicians actually teach how to approach this, because it takes a little bit of the ammunition away from the teen if they're going to argue back. So you give them, kind of turn the tables on them so that you're giving them the argument they would have given you. And then you ask them if they're aware of any harmful consequences. And so they're the ones telling you what they expected you to say to them. But at least for now, and until that becomes used so much that the teens are onto it, for the time being, that's the most effective way to work with teens about risky behaviors. And then, and also to reassure them that their feelings and experiences are just normal, and that it's just part of it. It's not just them, that these types of things are universal, just part of being a teenager. And teenagers might have a kind of that idea, but a lot of times I think they feel like it's just them, that they're experiencing this more powerfully than anybody else or whatever. So intake and history, I think I already mentioned all of this here. Also asking about substance use in addition to alcohol and sexual behavior. Okay, this is one of the most valuable tools that you're going to get from 1040, and that is motivational interviewing. And it is really, it has been shown to be a very powerful tool in helping people make changes, make positive changes in their lives. And so this, just remember these steps. And the first step, and I kind of already went over it on the previous slide. This is just giving it more as just strict rules to motivational interviewing that you could apply to any types of behavior. But the first thing is to seek, and you'll want to remember this too for the exam, in case that makes it more motivating, is to seek understanding, to just genuinely show interest and seek understanding of what's important to them, what they're feeling, challenges they're experiencing, goals they might have. So just seek to understand where they're at and where they're headed, what they want to do and become. And you do this by using reflective listening. So just ask a lot of questions without, being too directive, like they don't make them feel like they're being grilled, but just that you're really interested. And be affirming and ask open-ended questions and just do a lot of listening. So listening is a big part of this seeking understanding. Okay, second step is to invite them to share their goals. So that's an important part because that's going to help you get them to where they want to be. And so knowing what their goals are going to affect how you're going to guide them. Because in this part where they're telling you about their goals, yours might have a different format. Let's see if I can find it. You do. Oh, Megan asked, what if the parents won't leave? You ask them to, you send them on an errand, that something needs to be taken somewhere, and you send them on an errand. If they won't leave, if they just flat out won't leave, that's a red flag that there could be some sort of abuse problem going on, and then you might have to be more adamant. But yeah, you do try to get them to leave, even if you have to be. I mean, I don't know that you'd go so far as have security come in and drag them out of the room, but you would just want to carefully follow up if you couldn't get a chance to talk to the youth person privately. Oh, thank you, Megan, for getting in there to tell where this slide is. Okay, so part of the invitation in knowing what their goals are is you can help them to see any discrepancies between their goals and their behaviors. So that if you are, like, for example, maybe have a goal to go to college, but if they're misusing drugs, you could point out how that could cause enough brain damage that it might make it harder for them to think clearly and have patterns of behavior that will make college a lot harder to get into and stick with. So just help them to point out the discrepancies between their behaviors and their goals, and then guide them by asking their permission. Would you like me to share some information with you? And if you don't ask their permission to give advice or give counsel, they're probably not going to listen. So asking for their permission sends a signal to them that their opinion really honestly matters to you, and you're more likely to get them to buy into what you want to and cooperate with what you're sharing with them if you ask their permission first before you give them counsel. And then support. A super important thing is for them to believe that that a positive change can happen, because a lot of times they start feeling hopeless. So give them that support and knowing, and that you're going to give them the tools and resources and counsel and backup and whatever they need to. But you don't want to make them feel like they are helpless without your help. You want to make them feel empowered, or help them to feel empowered, so that the ball is in their court. They've got the responsibility, but they've got all the support in the world to make it happen. So they can make the change. They can choose and carry out a plan. Your team is, you're part of the team that's there to help them. And also emphasize that their choices that they make as adolescents can have life-changing consequences. Okay, nutrition. We already mentioned they have huge appetites because they're growing so much, and they do need to eat a variety of healthy, nutritious foods, and it helps to have more low fat or reduced fat dairy products, so no whole milk, in other words. Eat 3 meals a day with healthy snacks between, and limit fried foods as much as possible, and drink water. Water is so much better for you than any of these other things. Sports drinks could be good if you're losing a lot of electrolytes, if you're exercising so much that you're losing electrolytes, but other than that, water is the best. So harmful teen eating habits, and these are very common with teens, is to skip breakfast, eating high-fat foods such as fried foods or sweets, fatty foods, lots of ice cream and things like that. Eating out frequently, because fast food is really higher in fat, higher in salt, higher in sweets, and lower in nutrients. There's increased soft drink consumption, and soft drinks are so bad for you. We'll talk about that more in our early adulthood lecture, but choosing foods with empty calories, non-nutritive, and engaging in fad diets. So those are common teen eating problems. The common nutrient deficiencies are calcium. Adolescence is the time during a person's life where they have the greatest need for calcium throughout their whole lifespan. So they need more calcium as teenagers than they do at any other point in life. So they for sure need to get enough calcium in their diet. Females tend to have a deficit in iron because of menstruation, and vitamins A and D and B6 are also, they tend to be low on those. So, of course, we get our vitamin D from the sunshine, vitamin A from carrots, and B6 is in grains, healthy grains. So teach caregivers to keep a kitchen well stocked with healthy foods, and make unhealthy foods less accessible. Danger diet signs. These are like bordering on eating disorders. So again, we're not going to talk about eating disorders, but just, and this is an FYI, it's not something you need to memorize for this class, but just, and these are all red flags that could be leading up to eating disorders. So continuing to diet, even if not overweight, eating in secret, feeling out of control when eating, like binge eating, thinking about food all the time, so super focused on food, restricting activities, just looking at pictures of food, drooling over pictures of food, things like that, restricting activities to avoiding family and friends because of food or need to exercise, and feeling weak, lightheaded, or dizzy from inadequate nutrients. Okay, objective 6. So we are going to get to the point where the firearm one is going to pop up, but we are not going to do that presentation until tomorrow. The top 10 causes of death are, this is nationwide, are accident, suicide, and homicide are the top 3. And we'll hear from Braden and Aslan tomorrow. So it's good to do a safety assessment. If you get a chance to interact with teenagers as a healthcare provider, you want to know if they have a trusted adult that they can count on, and are they engaging in any risky behaviors? Is their home safe? Do they feel safe at school? Are they using good, safe dating habits? And are they driving safely? So talking about driving first, car accidents is a leading cause of death in teens, are the leading cause of death in teens. And part of it is that invincible mindset. So they're willing to take risks like texting and driving. They're texting, oh, I'm fine, I'm safe, I'm doing that. I can multitask. And 40% of teens admit to texting while driving, which makes you wonder how many are doing it and not admitting it. So they also, again, have that poor judgment. And since they're new drivers, they just don't have as good of driving skills. It's easier for them to lose control of the vehicle. And they're more likely to drive while intoxicated and less likely to wear seatbelts. So I told you we were going to get to dating safety. So these are all things that we like to encourage with teenagers to have the safest possible dating experience. And the first one is pictured here is to do great group dating or go to places where there's lots of other people around and use the buddy system. So, and by group dating, so you have not only your opposite gender date with you, but your same gender, assuming we're talking heterosexual, but it doesn't necessarily need to be left to that. But yeah, basically leave it at that there are, it's safer if you've got group dating, lots of people around. Be alert to the surroundings. So if you felt the need to leave quickly, you know where you can exit, and be listening for approaching attackers. So avoid using headphones. Always have access to a phone, and no drugs or alcohol. Minors should not drink, so especially not when dating. So avoid anything like that. And then create a code word. So if you do need to call somebody while you're on a date, create a code word to signal that you need help. So that if a teen is not feeling safe in their situation, and so they don't awkwardly have to call and say, hey, I need some help, get me out of here, or meet me at such and such a place, they can just use a code word, and then they would know that whoever's on the other end of the line would know to respond. Objective 7, health maintenance. Sleep is very important for teens because they are growing so much and they do experience those growth spurts. Lack of sleep results in poor concentration and performance, and teens often stay up too late, either with work or studying or hanging out. So they do try to push the envelope and getting by with as little sleep as possible, but they do benefit from naps or getting caught up on their rest. Ideally, they should be getting their however many hours of sleep they need each night, 8 to 10 hours of sleep each night. But naps do help if they have to, if they're not getting enough at night. So I've been saying that we should do physical exams every year or two, and that's pretty ideal. But when they get to be involved with different sports, different things going on in adolescence, a lot of the activities they want to participate in have a requirement for a pre-participation physical exam. So sometimes they just line them up and a doctor comes along and looks at them and signs them off. But it's so much better if they can actually have a real physical exam where the doctor takes the time to talk to them, assessing for their history, their health, their safety, all of these things that we've been talking about, and any risky behaviors, as well as doing the physical exam. And then if you are ever interacting with an adolescent and they bring up a health concern, you really want to focus on that health concern, because they don't bring things up lightly. Like they don't tend to bring things up lightly, like, oh, this is just something that on a whim crossed my mind, I'll throw it out there and ask about it. Usually they only ask about something if it's been a concern of theirs. So you want to dig deep and get to the bottom of it, even if it might seem like just nothing. Dig a little deeper and find out why they're asking, and get to the root of whatever the issue is that they're bringing up. Let's see. Of course, we're going to screen in an exam. We're going to do the basics, get their height, weight, and their vital signs, including blood pressure. We want to screen. Okay, so this is from the U.S. Preventative Task Force Services. Recommends that all teenagers be screened for depression. Since depression is so common, we need to be screened for it, as well as obesity. And doing something with it. Obesity is just like the elephant in the room. And I don't mean, I mean, it's, that almost sounded bad. I don't mean it by size, but I mean that it's the thing that's there that we know that's there, but we're just not talking about it. And that's because it's so common, we don't think of it as that harmful, but it really, over the span of a lifetime, obesity is very harmful. And we'll talk more about why that is in the middle adulthood lecture. But so we need to be screening for obesity and treating it. So doing that motivational interviewing to help people to establish habits and patterns that are going to help to get rid of the obesity. And then also, if find out if they're sexually active, and if they are, you'll want to talk about contraception and screen for STIs. Counseling, it's good to use. Somebody mentioned this, I think, in the chat box when we were talking about the outdoor safety is to protection from the sun exposure. So that's a good one to think about, and that's for light-skinned people. And prevent initiation of tobacco use. So really discourage that. Dental care is to continue with good oral hygiene, and like we've been talking about every lecture. But one thing that might be new is orthodontia. So if their teeth are crooked, they might require braces. So they would need follow-up with that. Immunizations, again. This is the same one we looked at with at the end of the school age child, but this is all I'm going to say about this is the HPV. If they didn't get HPV when they were 9 or 10, we do want them to get it when they're 11 or 12. And studies show that remember I said before that parents are sometimes reluctant to have their kids be vaccinated against HPV because they feel like it gives them permission to engage in sexual behavior. But the studies show that teens who have been immunized against HPV are not more likely to engage in riskier sexual behavior. So there's not a cause and effect with that. So you can set the parents' minds at ease. Utah is one of the lowest HPV vaccination rates of any state in the union. So we've got a lot of room for improvement here locally. So objective 8, it looks like we will not only finish adolescence today, we're going to finish early because it's not going to take me very long to cover this. So I'll tell you what the plan is for tomorrow once we finish this. So objective 8 is discipline. So here's where collaboration is extremely important. I brought it up under school age that you want to kind of talk to the kids to help them to establish logical consequences. Teens, in order to get their buy-in, for them to have any respect for the discipline, they need to be part of the conversation on establishing the rules, and that they need to feel like they are being listened to, and that the parent is respecting their viewpoint. So it really is a collaborative effort for the teen years. And that's not to say that the parents are going to give in to everything the teen wants, of course not, but the parents are going to listen, and they're going to have a conversation about, it shouldn't be a debate, because the teen's going to win if it's a debate, right? But just have a conversation and come to a consensus. And it's important to have consistency and predictability, and independence is promoted by discipline that employs listening, explaining, and making expectations clear. So here's the table for teens, which you guys have. And here's where I told you I was going to get to a minor's right to privacy. So in the state, it varies from state to state. So this is in the state of Utah, a minor can be treated for a sexually transmitted disease without parental consent. A minor can also consent to medical services related to pregnancy, again, without parental consent. Any minor who has or has been married, so an emancipated minor can consent to vaccination. I think it's interesting that any minor can be treated for STIs or pregnancy, but they have to be emancipated to give consent for a vaccination. Let's see, and then this one, Utah law is silent about a minor's ability to consent to other treatment types, including those related to contraception or family planning. So Utah law doesn't say whether it's legal, whether a minor needs parental right or parental consent for contraception or not. So most providers see that as tacit permission that they can provide contraception without the parents' consent, if that is the adolescent's preference, because of their right to privacy. So they are allowed more privacy than what you might think they are. Most states do allow for contraception without consent, but Utah just doesn't say yay or nay, which is interesting. Okay, so if you have any questions about this unit, go ahead and type them in the chat box. But let me tell you what the plan is for tomorrow. So tomorrow we will start out with our presentation from Braden and Aslan on firearms. So that will be right at 12:30. And then after that, since we do have that class time available to us, I'm just going to plan on doing the review for the next exam during class time tomorrow. Okay, so come if you get a chance to look over any of your notes, or at the very least have the tables printed out, where you can, or have easy access to view them and to make notes on them. And I'll kind of go over, and I'll try to be efficient and make the time worth your while. Of course, it's not optional; it's class time, so and it's just going to help you benefit you on the exam. So I'm not seeing any questions in the chat box, so I'm thinking we're probably good. And so that lets you out a little bit early today. Enjoy that, and we'll see you back here tomorrow at 12:30. Oh, you don't need, thank you, Mapu. You don't need to submit the letter. It would be fun to read them, but I'm not, if you want to, you can send it to me, but it's not required for the, I will create a learning activity and give you all participation points for participating in the learning activity. And also, did anybody get a bingo for the internet bingo? Let me take a poll. Yes or no? Did you get a bingo? So there's just a few of you who got a bingo. If you got a bingo, you're going to be in today. Come to my office and get some chocolate. I'll just be, and anybody is actually welcome to have any chocolate. I'll have it in the practice lab because that's where I'm going to be. I'll have a basket of chocolate, and help yourself to some chocolate. And for sure, if you got a bingo, make sure you get some chocolate. Oh my goodness, did I bring? I got to make sure I remember to bring my chocolate. Oh, I got a new bag and I left it at home, but I do have some. I just don't have a ton, but I'll have some. So the people who got bingos get first choice and first pick, and then I'll have more in my office for later on. Publishing results. Okay, have a nice afternoon, and we'll see you here back at the school for your labs. Bye. Oh, wait, let's see. Does anybody have a question? Oh, some of you were closed.